Okay, and who just joined us? Audrey?
Audrey. Hi.
Hello, Audrey. Audrey from New Zealand. Welcome to you.
Thank you.
Okay, so I've just pressed record, so we're going to get started. So, welcome everybody. My name's Eddie Bartnick. I'm chair of the Sponsoring Countries Leadership Group for IIDL. And as host, I want to warmly welcome all of our Sponsoring Country Leadership Group members from IIDL, but also importantly, we've got board members and also Sponsoring Country Leadership Group members from IIMHL as well. So very, very pleased with that. And Bob as chair and Barbara as board member. And I think Erin Groves is also trying to join us. So welcome to you. And Fran as CEO, welcome to you as well. So this meeting is for the US, Canada, New Zealand and Australia. So it's the first two meetings. So we've got different time zones all over the place. So just welcome and thanks for making the effort. Also like to warmly welcome our presenters from the United States, in particular Ruby Moore and Jennifer Johnson, who are co-chairs of the US Advisory Committee, and they'll be leading the session today. So just a bit of brief Zoom etiquette. So we're going to be recording the session. We think it's going to be fantastic, and so we want to make a good record that we can put on the website and share with loads of people. Can you also just please mute if you're not speaking? That sort of helps preserve the connection. And if there's too much background noise, I might need to just mute you myself. So just a little bit of warning. Suggest you use gallery views, that way you can sort of see everybody, and that'll be great. And you can pose questions and comments in this chat function, and then Kathy will be keeping an eye on that. And we'll come back to those questions and comments towards the end of the session. So also want to introduce Kathy Langlois. So Kathy, if you can just wave, yeah, Kathy's gonna, we've got a very ambitious program, so she's going to be keeping people on time. So she'll be doing the 1 minute warning. If you know Kathy, I'd be paying attention to that. So 1 minute warning, which is a sign that if you can just start wrapping up, that'd be great. Because we do want to try and preserve some time at the end for questions and comments. And Kathy will also be keeping an eye on the chat discussion, and will be helping me at the end pull together some questions and some comments at the very end. Okay, so I'm going to hand over in just a moment to our US presenters, and I'll come back and help Jennifer in particular manage that discussion at the end of the session. So now it gives me great pleasure to introduce Ruby Moore, who is co-chair of the US Advisory Committee along with Jennifer, and she'll be introducing the presentation and also introducing the US Advisory Committee for IIDL. So welcome to you, Jennifer. Not Jennifer, it's Ruby, sorry.
You've seen one strawberry blonde, you've seen another, right? Thank you, Eddie, and thank you everybody for joining us. Good morning and good evening. I'm extraordinarily grateful to all of you, but particularly people who got up at 3 o'clock in the morning to come have a cup of coffee with us and have this important conversation. We're really excited about the launch of IIDL US, and Jennifer and I are, really honored to be the co-chairs. Over the next little bit, I realize that some of you are probably quite familiar with the US, and maybe somewhat are quite familiar with the complex systems that we're operating within, and probably others this may be new. And so we decided it would be important to start by creating a level playing field as a foundation for our relationship with each other and some understanding about, the work that we do. Over the next couple of hours, we are going to attempt to discuss roughly a half a century of work in advancing best practices and protections from harm within the context of a very intentionally designed federal system, a federally funded system that involves many moving parts that you'll hear a lot about. But Mostly we're about saying, how do we have the best collective impact to create a context and to change law and policy and best practices so that people with developmental disabilities, and more broadly people with disabilities, you know, have good lives, fully participate in community life, and are protected from unnecessary harms. So with that, I just want to welcome you, and we have just a stellar group of people, both as the presenters and the audience. So I'm very excited about us engaging with each other around this. And we're going to begin with, let me just say that Cecily Coulson's going to be sharing, you know, the PowerPoint here, and she'll be managing this. So thank you, Cec. And we'll begin with Dr. Tawara Good. Tawara, might have to unmute.
Okay, sorry about that.
All good.
All right. So I'm really pleased to be here, and want to thank Jennifer Johnson and all of the countries for allowing us this opportunity to share our experience with you. So this is, next slide says welcome and introductions. So I'm not sure that that's my slide. Okay, there we go. My charge is to give you an overview of culture and values in the United States, and to really look at what that means within the context of disability leadership. I would say that it was a challenge to put this together and to think about what I could share with you within a space of 10 minutes. So we'll begin now. Next slide, please. As I did research to look at what are values in the United States, I know that I had an idea about what they were, but I wanted to see what the literature was saying and to really look to see which ones were consistent across the board. And I selected the 6, although I would say that I can't guarantee that these are the only 6 values overall. And so as we look at these values, individual freedom, equality of opportunity, self-reliance, hard work, competition, and the American dream. And I just want to share with you that I went through to really think about what these values mean within the context of the US, not just historically, and also our present day realities. So I will advance the next slide, please. So next slide, please. Okay. So if we look at the 6 basic values, and some of these I lumped together. We'll go back one slide, please. So we look at individual freedom. This is a really important concept in the United States. It's embedded in our founding documents, including the Declaration of Independence, the US Constitution, and the Bill of Rights, and give some images for you to see these historical documents. Everyone who knows history, part of this freedom was freedom from what is now known as the UK. And so this is just, again, very embedded in who we are as individuals, families, communities residing in the United States. Next slide, please. Another basic value is equality of opportunity. Gave you images of scales of justice, and also the Statute of Liberty. We look at this as a welcoming nation, at least historically, that is what we were founded on. We were founded as a nation of immigrants, and that currently really is depicted in who lives in the United States of America today. Also, the 14th Amendment to the Constitution prohibits discrimination based on race or religion, gender, etc. And so that this amendment really does reinforce the concept of equality of opportunity for all, which is also very closely related to the American dream, and we will talk about that. But this notion of equality of opportunity is very important. Next slide, please. These other three I lumped together because I think that they're very much related. Self-reliance, hard work, and competition. And so as we think about the United States of America and really look at this within the context of people with disabilities, and to really think about what might these values mean in the lives of people with disabilities. So as we had said before, independence is highly valued. So this notion of being dependent on someone else for your well-being is, to some people, very shameful and embarrassing, because you should be able to pull yourself up by the bootstraps and take care of yourself. Self-reliance, again, is a behavioral norm. As we look at this whole notion of rights, that the rights of individuals tend to take a higher degree of precedence over everything else. We are expected to work hard. Failure or inability to work hard, whatever that working hard means, is frowned upon. And lastly, hard work underlies competition, which is also a bedrock of a successful society. So these are values that are just etched in who we are as Americans and people who reside in the United States. Next slide, please. The American dream. I did a lot of reading and discovered several things. There's all of these images about what the American dream is, and you'd see a house and a picket fence and, you know, a lot of, I'm gonna say, material things. The whole notion of the American dream is indeed enshrined in the Declaration of Independence. And the language at the time is that all men are created equal and that they have certain inalienable rights. Among these are really looking at life, liberty, and the pursuit of happiness, which is a very powerful statement, because it's not just life and liberty, but also the pursuit of happiness. Then as I continued to search about the American dream, I discovered James Trenslow Adams, and I actually did not know of his work. He wrote a book in 1931, The Epic of America. And in that, it's a statement about, I'm gonna say, earlier conceptualizations of American dream. A dream of social order in which each man and each woman, that was back in 1931, shall be able to attain the fullest stature of which they are innately capable and be recognized by others for what they are, regardless of the fortuitous circumstances of birth or position. I found that very, very powerful. And I'm not sure, as we think about the American dream as it has evolved over time, that that is the current conceptualization. Next slide, please. These other characteristics are very important, both capitalism and federalism. So that the United States is indeed a capitalistic system, and it really is characterized by investment and individual ownership. And I think that is really very important, especially contrasted to those nations that are more cooperatively or state-owned means of wealth. So capitalism is the order of the day. And then as we think about federalism, it's a system of government in which entities such as states, since we have states, not provinces, share power with the national government. That may, I'm not going to say that's uniquely US, but is a very particular form of government. And I think it reflects some of the earlier values around independence overall. Next slide, please. We have some new values that have evolved for people with disabilities, and these are not all inclusive. I'm sure that if we look at this list, other people may be able to add some other ones. But these new values really look at self-advocacy, self-determination, meaningful inclusion, not just inclusion, but meaningful inclusion, independent living, productivity, person-centered, and culturally competent. And I would say that culturally competent is indeed enshrined in the Developmental Disabilities Bill of Assistance of 2000. And so that as we look at these values, and these have evolved specifically around people with disabilities, then what do they mean in this unique US American context? Next slide, please. So as I think about this in terms of disability rights and leadership in the US, we know that the values that we talked about really apply to everyone who live in the US, its territories, and also tribal nations. And I think it's very important for us to recognize the span of these communities and these various ways in which our government and lands are enacted. However, when we think about these values, that the population of people with disabilities have been slow to share and realize their benefits. So that even though that there are these values, again, they have not really found their way into the lives of people with disabilities across the board. Even though we have great legislation, national legislation, we know that people with disabilities continue to experience discrimination. They continue to be marginalized. They continue to experience issues of bias. And this really does impair their capacity to really pursue the American dream, at least the way it is indeed articulated. And so as we think about equality of opportunity, it's also further compromised by the concept of intersectionality. So this really reflects historical and present day things that are happening in our country. And this is looking at the intersection of race and ethnicity and gender, socioeconomic status, LGBTQ identity, and other cultural factors. And so if we think about a group that's already marginalized, just simply in terms of who they are, that they continue to be even further marginalized and experience issues of intersectionality because of the multiple cultural identities that they bring to the table. Next slide.
Hi, Tawara, I'm just going to give you that 1 minute time check.
I think this is maybe the last slide, but next slide, please. So quickly, if we think about Justin Dart, who is the father, okay, we can go back one and leave it on that one. The father of the American with Disabilities Act said that ADA is not equality and is not employment. ADA is a promise to be kept. And what is that promise? For whatever the law says legally, the clear promise of the ADA is that all people with disabilities will be fully equal, fully productive, fully prosperous, and fully welcome. And looking at this within the mainstream. And what he challenges us to think about in terms of disability leadership is keeping the promise of the ADA. It's not going to be easy. So again, this gives you a really quick thumbnail sketch of looking at our values and our culture in the United States. Thank you.
Thank you. Thank you, Tawara. Next up, we have Dr. Amy Hewitt.
Good morning and afternoon and evening, everyone. As I said in the chat, it's good to see everybody's face as we've been planning and then to see it all come together. I'm thankful that everybody could join us. I had an equally challenging job as Tawara in that I was asked to describe the service system for people with intellectual and developmental disabilities in the United States in 10 minutes. And so we'll just get going. Next slide, please. I forgot to introduce myself other than my name. I direct the Institute on Community Integration at the University of Minnesota, and we are our state's University Center on Excellence in Developmental Disabilities, as well as our leadership education in neurodevelopment in our state. And as you may have heard, our city is in just a horrible turmoil right now, and you will likely hear sirens and fire trucks as I'm presenting. But good steps are being taken, policies being changed, and I think we're turning a corner toward hope, so that's good. Anyway, on this slide, I think the most important message is probably the most important slide of all of mine. We are the United States of America, and as Tawara said, we have a number of states, and typically things happen connected with states and federal governments. Can you hit the clicker? You might have to do it one more time. Might not be working. This is supposed to, when you click on it, show you the 50 states, the territories, and the District of Columbia. And then also to show you that we have over 3,000 local entities or cities. And together across the United States, it's a complex system. And what complicates it is that we don't really do anything nationally when it comes to disability services. We don't have a national disability program in any way. And then because we have so many states and states have their own rights and their own programs, we have very different services across the United States. In all of our research that we've ever done, the state in which you live in and your zip code is the single biggest predictor of the types of services you get and the outcomes. So it's such a huge factor, and I think it's just a really important context for everybody to understand. Another important context, next slide please, is that we really don't have a national health insurance program in the United States. Most people have private insurance, and then we have kind of a mix of options for healthcare depending on various characteristics of an individual or their family and context. So in 1965, we developed a program called Medicare. It's a federal health insurance program that targets people over 65. And then in 1972, it was modified to include people with a long-term disability who also are receiving Social Security disability income and have done so for a couple of years. So it's one way in which we get health insurance or health care to people with intellectual and developmental disabilities in the United States. It's about 20% of our total national health care spending. Next slide. We also have a program called Medicaid, and it's a public assistance healthcare program. It targets populations. There's some variation by states because some states add or have a more open Medicaid program than other states do. It typically targets low-income adults, children, pregnant women, elderly adults, and people who are blind or disabled. And there is an income requirement. So in order to be eligible for this health insurance program, you have to meet the eligibility requirements of income. It's a shared program, so the federal government does not pay for all of it. It's a federal share, state share program. When I talk to students about it, I always tell them it's kind of a 50-50 split, but that depends on what state you live in and what specific program we're talking about within Medicaid. And about just under 18% of the US population receives Medicaid. Medicaid is the single largest funder of our long-term services and supports in the United States. So it's the biggest funding stream or funding capacity that we have or use in the United States to fund services. Next slide, please. I'm just going to quickly mention another health insurance program, kind of goes hand in hand with Medicaid, the Children's Health Insurance Program, and it's a health insurance program to cover eligible children, and there are about just under 10 million children involved in it. These, this program is kind of through, many states design it to be kind of along the side of their Medicaid programs, but I left it in here because I think it helps to give you an idea of the complexity of just getting health care for people with disabilities. Next slide, please. So as I said, every state is different, and so Medicaid pays for most long-term services and supports. Medicare covers a little bit. Given that every state is different, they have a menu of options that they provide for individuals with disabilities and their families. The largest program is called Medicaid Home and Community-Based Services. I left this slide in here. I'm not going to read every word in it. If you put a slide up that described the program in the District of Columbia, where Tuara is, or in Texas, or whatever state, the waiver programs listed on that slide would be very different, and the legal authority at that state level, the statutes at the state level, would be very different. And it's not one thing, it's multiple things. So when you get to the state level, we have 6 different waiver programs that deliver services to people with disabilities, and lots of statutes that govern it. Next slide, please. Another really important, we don't often think of special education as a long-term services and support in the United States, but it really is. We rely on it, we're dependent on children with disabilities receiving special education. Their eligibility is based on 13 broad categorical considerations around the type of disability they have, and they get supports and services while in school based on an individual education plan. Next slide, please. The next slide that I'm going to show you just is to show that we really struggle in inclusive education. Tuara set forth some of our values, and much of our data doesn't show we're quite there yet. About 80% of students with intellectual disability are in self-contained classrooms. Next slide. One aspect of our system in the United States is that we do have a number of longitudinal data sets that really help us to understand our service system and how it changes over time. This slide shows our commitment to deinstitutionalization, or moving people from large institutions that peaked in about 1970. And over time, we've been able to pretty radically reduce the number of people with intellectual and developmental disabilities that live in large congregate places. And today we have less than 20,000 individuals living in institutions where 16 or more people live. Next slide. This is just another way of looking at our deinstitutionalization movement. For each of the bars kind of show you how many places have closed and how many places are anticipated to close based on the calendar year. I can see in the translation the bars for the 2015 to 2019 and 20 to 24 didn't show up, but the numbers at the top of each of those bars is how many actual institutions have closed over time in 5-year intervals. So you can see we've actually closed well over 200 institutions in the last 30 years, which is an important milestone in our service system. Next slide, please. Most people who receive services in their own home or in their family home. And most people with intellectual and developmental disabilities don't receive services at all. So when we're talking about, or the data that I'm showing you around residential and employment services, these are people who are known to state agencies and receive services that are funded through state DD agencies. And that's a huge challenge for us to make sure that we're actually being able to support people in their own homes and to get them the services that they want. What you can see in this slide, the dotted line shows kind of growth in more individualized support. The blue line down the middle shows a decrease in more congregate group home kinds of settings. Next slide,
Amy?
please. Yeah.
Amy, you have 1 minute.
Okay, thanks. Next slide, please. In terms of employment, this gives you just a quick picture of where people are working if they have an intellectual disability. We've sort of stagnated our growth in integrated employment, reduced a little bit our facility-based work, and most people are in non-work situations during the day. We spend a lot of money. Our service system is about a $70 billion investment. Next slide, please. And I'll end with next slide, please. It's going in the next slide, please. There we go. In terms of our Medicaid spending, we spend quite a lot of money on individuals. The previous slide has data on that you'll see when you get these slides, but it ranges from about $12,000 a person per year to about $142,000. We do have a national program where in most states we're collecting outcome data. This just gives you a picture over time of life decision making and staff stability through our National Core Indicators program. And the very last slide in my last 10 seconds is simply to say we don't really have a national quality assurance program or quality indicator program. We have a framework, but the federal government rarely tells states thou shalt measure quality in this way. States have a lot of flexibility to make those decisions on their own. And I'll stop there. Thanks.
Thanks, Amy. That was amazing, plowing through all that in 10 minutes. I'm sure everybody has a good grasp of our complex system now. But thanks for that introduction. That's helpful. So next we have my co-chair of IIDL US Advisory Committee, Dr. Jennifer Johnson.
Well, hello, everyone, and my apologies. You might be hearing my dog barking in the background right now, and hopefully he'll stop soon. But it's great to be here with you all today and to share information about the U.S. system and then what we think is a very unique network within the U.S. That really helps us to work towards advancing services and supports and quality of life for people with intellectual and developmental disabilities. So a little introduction of myself. I am with the Administration for Community Living, which is a part of the U.S. Department of Health and Human Services. So I am part of the federal government that has been mentioned during this presentation. We are not on the side of Health and Human Services that funds the Medicare and Medicaid services. So we're not part of that big part of HHS. And we're also not part of the special education services and supports. But what we are is we're a very small entity within the US that makes what is somewhat of a small investment in a network of programs in each state and territory that, again, work towards creating better opportunities for individuals with intellectual and developmental disabilities. And it's allowed us to really come a long way for this population. I think generally people with IDDD have not benefited from what you heard Tawara describe as the American dream. And because of this network, we've been able to see some progress. As Amy noted, she showed you some data on how people are now living more in the community and have greater opportunities. And if we could go to the next slide, I'm just going to show you some pictures of changes that we have seen in the US for this population. And while the slide is changing, I think what's important to note about this population is that we can very easily overlook people with IDDD because of the assumptions that society makes and the low expectations that people have for this population. And I think these pictures certainly show that at a certain point in time in our history, and I think probably history of the world, that we didn't really value people with IDDD and thought the best place for them to be was in an institution where they were cared for in these very large settings, but not really oftentimes cared for. There was a lot of abuse and neglect that, again, we see in these pictures and many more of the way people with IDDD were treated. And so very easy to overlook this population, but because they weren't overlooked, and we have this network of programs. If we go to the next slide, we can see that in many ways, people with intellectual and developmental disabilities are able to lead much fuller lives in the community. And so we see them having greater opportunities. We still know that there are many opportunities that we need to build upon and create more, but that we've really made a shift in the US where people with IDDD are much more a part of our culture and our society and actively engaged in many ways. If you can go to the next slide. And I think fortunately my dog stopped barking, so you won't hear him in the background. So what I'm going to be talking to you is about the role of what we call the Developmental Disabilities Network in helping to achieve that change. And if you can go to the next slide. So as the Administration for Community Living in HHS, we invest about $165 million US dollars in this network of programs in each state and territory that really have a specified specific role and function that individually and then as Ruby said earlier, collectively create action and change in each state and territory. We heard how the United States is comprised of the 50 states and the US territories, and that creates for a lot of variability across the US and no national system. But what this network allows for is there to be able to have these entities in each state and territory address specific needs within that state and territory to, again, advance issues for people with intellectual and developmental disabilities. In this slide, there are people in the background because it's not just about these programs, it's really about the people and the people who really have been a part of these programs and have helped to propel them forward. We wouldn't have these programs if it weren't for the people. So there's very much an important role that individuals and families play in these programs. If you can turn to the next slide. I'm just going to take you through a brief history of the DD programs, which is, as Ruby had mentioned before, there's over a half decade of work of these programs in the United States that has really helped to advance services and supports. So the DDAC programs date back to the 1960s. And I think when we look back over time and we see movements that have really succeeded in the US and elsewhere, that we often see that there is a champion for those movements. And for the Kennedy family was very much a champion for individuals with intellectual disabilities because they had a sister with an intellectual disability, and they were told to put her in an institution, which many families were told at that point in time, and the family said no. And so when President Kennedy was in office, he wanted to address the issue of having individuals with intellectual disabilities actually living in the community and living with their family. So he appointed the panel on mental retardation, which it was called at that point in time. And out of that panel, there were a number of recommendations, one of which was the recognition that if we are going to have people living in the community, we needed to build the capacity of individuals to be able to serve them in the committee. So the idea was to create these university affiliated facilities where training and service could occur in the community rather than in these institutional settings. And that was the start of what we know as our University Centers for Excellence in Developmental Disabilities, or UCEDS, that we have 68 of today. Could you go to the next slide, please? And then over time, there was a recognized need really brought forward by family members who said, you know, our children really need to have a voice in this national movement. And so there was the Developmental Disability Councils that were established in 1970. And then as a result of some exposés around what was happening in institutional settings and the abuse and neglect, Congress recognized the need to have what is called a protection and advocacy system to assure that people were able to be free of abuse and neglect and have access to legal services to avoid that from happening. They also recognize the need to have a national discretionary grant program to address national issues. So we also have what's called projects of national significance. If we can move to the next slide, because I only have a couple minutes left here. And while we're okay. So this slide just shows you basically the mission of the DD Act, which I think we've already talked about, but I think it is unique because again, it puts people with IDD at the forefront and really empowers them to be fully participating in society. Next slide, please. So in terms of this DD network as it exists today, as I mentioned earlier, we do fund each program in each state and territory, the State Councils on Developmental Disabilities, the State Protection and Advocacy Systems, and the University Centers for Excellence in Developmental Disabilities. But really, again, at the center of that is individuals with IDD and their families, and really empowering them through their different functions to be leaders in their state and at the national level. We've seen a tremendous number of leaders who have come out of the DD network that has really helped to advance national level issues. In terms of state councils, and we have folks that will be digging in a little bit more to tell you more about what they do, but state councils are really where individuals with DD and families have a voice at the state level to identify what the needs are, to develop leaders and promote self-advocacy, and then also test and promote innovation. They are a voice in policy and in policy change at the state level. And so they're really key leaders in the state. As I mentioned, there's also recognition of a need for a legal advocacy function within the DD network, and so our state protection and advocacy systems do that. One of their most important things, perhaps, or one of their key things that they do is monitor for abuse and neglect. So they're out there actively identifying where abuse and neglect may be happening and addressing that. They provide both individual and group representation to be able to address issues where abuse and neglect or discrimination is happening, and to then ultimately ensure equal access to the community. And then the role of the university really—
Time check for 1 minute, please. Thank you.
Thank you. So the university centers then, their function really is to bring in my own timer went off. To bring in the role of the research and training capacity and how we really translate knowledge into action and really build the capacity of the workforce that will serve people, and doing it in a way that advances practice so that people go out into the field recognizing the need to support people in the community. So again, each of these entities work in the state in their own specific way, but then collectively they work together as a network and really can have a powerful impact in the state to make change. And because we have these programs and this investment, which again is a pretty small investment for the federal government, it's an incredible return on investment in terms of the kinds of changes that we have seen for this population. And so that's why you see some of that data where people have moved out of institutions and more into the community and better able to take advantage of opportunities in the community because of the work of this network. But again, many of the folks, individuals with IDD and their families that have been behind that as well. So we still have a long way to go, issues that we have to address, but certainly, like I said, this network has played an important role. I think I have another slide that just talks about how the relationship that we have with if you want to keep going to the next slide, the relationship that we have to the grantees really allows the federal government to have a connection to all the states and territories. So for example, with COVID-19, because we have these programs in the states and territories, we're able to keep a pulse on what is happening in the states and territories related to COVID-19. And if we need to reach into a state, we can do that. So it gives the federal government a real important access point to the state and to communities to be able to advance change. So these slides you can take a look at when you get a copy of them, just a little bit more information about the Administration on Disabilities, which is an ACL, but also, again, this relationship that we have as the federal government with the states and territories through these programs. So I will end it there. I'm sure I'm down to past my minute and turn it back to Ruby, who will turn us to our next speaker.
Thank you, Jennifer. That was quite extraordinary to compact a half a century into the 10 minutes and give us a nice overview. So next up, we're going to look at the 3 Developmental Disabilities Network partners with a little bit of a deeper dive to give some real life to what Jennifer was talking about. And so we're starting with Dr. Beth Stalvey from the Georgia Council, not Georgia, the Developmental Disabilities Council in Texas. Sorry, I'm so used to saying the Georgia Council. But Beth, thank you so much for joining us today.
Thank you so much. Hello, everyone. I do not have a particular slide, so I will just speak to the gallery and share some examples from the DD Council perspective. As Ruby mentioned, my name is Beth Stalvey, and I serve as the Executive Director for our State Council on Developmental Disabilities in the great state of Texas. I am very pleased to join you today to share some of the unique features of how we operate sort of at a state level in a unique way, and if I may be so bold to say, quite powerful characteristics that we have in our network, as Jennifer had just mentioned. So our entire network, but DD Councils in particular, are driven by our Developmental Disabilities and Assistance Act. And we are charged with not only keeping individuals with developmental disabilities visible in our systems, but also charged with pushing the system forward to fully include individuals with disabilities and allow for living independently. And I think that Jennifer's slides very well articulated and demonstrated how historically our country has not fully supported individuals with disabilities to be included. I think there's many reasons for that. I know we won't get into that. It is certainly how we have valued folks, but I do believe that in some cases it is because our policy leadership and our providers have really had limited experience. They really didn't know how to do it. How are you supposed to support people with intellectual and other developmental disabilities to live, work, and play in our communities? So our councils really challenge the system and test our new models. As Jennifer mentioned, we have a relatively small budget, but really we use that money very efficiently to try projects, to test new models, and to do things that have not been done before, really on a small scale, which is a way for us to conduct research. We obtain data about what works. We also can collect data on what doesn't work, and we use all of that data to show our governments how individuals with disabilities can be supported and to demonstrate and show what outcomes can be achieved on a larger scale. We are, I will share examples of what our specific council has done. It is very similar to the work of my 56 colleagues. Again, we are state specific, so of course, Texas is very different than every other state. So we are able to adapt to our own cultures. But in terms of overall activities, we conduct activities very similarly. So one example I will share of DD Councils is around our collaboration and connection. I understand that the partnership here today has convened based on principles of collaboration across all sectors. And councils and our network really do share that same goal. We are the only entity that sits in state government that is solely focused on the strengths, needs, and impact of government policies and practices on the inclusion for people with developmental disabilities. Unfortunately, as Amy mentioned, there are many silos in the United States based on individual funding streams and specific programs, and our councils and our network really serve to connect partners across our state government systems to provide better and consistent support. Again, I'll use our most recent example of responding to COVID-19 pandemic, as Jennifer also gave an example. Without DD councils and representatives from our network talking to leaders in our neighborhoods and at the state level about the impact on individuals with disabilities, they likely would have been overlooked. I can tell you many examples in recent weeks of speaking with health departments and other leaders who have admitted that they had not adequately considered the impact on individuals with developmental disabilities. We were able to share expertise, information, and make recommendations on how to keep our state residents safe. Another area that our councils are very involved in and where we invest most of our dollars is around capacity building. As Amy mentioned, our system is very state and locally based, and seamless support really does require partnership between government and our trusted community entities so that individuals may live and work in our communities. Some specific examples of things that we fund. One is around university study and post-secondary education. We know that individuals with intellectual and other developmental disabilities generally do not attend college or obtain advanced degrees. And so we have been able to conduct programs that show how individuals can be supported on campus, can be successful in meeting their academic requirements, and can graduate college with degrees, which for the United States will lead to higher paying employment options and higher wages, which can certainly support independence. In terms of healthcare, we have many individuals, as we all know, that may avoid services such as dental care. And so with some of our funding, we are able to demonstrate and learn how we can modify our practices and implement specific strategies to make individuals with developmental disabilities more comfortable during this process. We already have collected data and evidence that individuals are increasing their participation in routine dental care, which can prevent more expensive treatment later. And now we can share those techniques and strategies with our medical schools, our dental schools, and our other providers. Similarly, with mental health, we are able to provide training and education in sectors such as schools, so that teachers may better recognize signs and symptoms and be able to connect students with appropriate mental health resources. Finally, today, one key element that I wanted to talk about is, again, the strength of our network in promoting self-advocacy. I was just speaking with someone today and had to remind them that just because you don't hear from individuals with developmental disabilities in our states and neighborhoods does not necessarily mean that everyone is okay. And so we know that from the DD Act and from everyone that we participate and support, that the best people to speak about issues are those who have the direct experience of living with a disability and being in families and trying to access services and supports every day. And that's why our councils and boards are comprised of a majority of individuals with developmental disabilities and their families. Our boards are 60% individuals so that they may have the majority vote on what we fund, the projects that we do. It is truly driven by individuals and families. Similarly, we not only have our board constructed that way, but we invest a lot of our dollars into self-advocates and family members with the goal that they come to the table to be an active participant in the policy-making process. Now, sometimes participation in our policy process does not come naturally to folks. And so as a council, we fund multiple training and skill building projects so that individuals may understand the policymaking process and how to better articulate articulate their needs with those audiences. And so we connect individuals to state, local, and local boards and commissions so that they truly have a voice. Here in Texas,
can I give you a 1-minute time check, please?
Yes, ma'am.
Thank you.
Thank you. In terms of self-advocacy in Texas, we do specific programs that are tailored toward our young adults. We have specific programs to encourage advocacy in rural areas. And we also are conducting several projects that involve advanced leadership and advocacy training and fellowships so that we may ensure that we have a next generation of disability policymakers. That is all I will share at this time. Thank you very much for the opportunity to share the work of DD Councils with you today.
Thank you, Beth. It's another great reminder that we're having hot hors d'oeuvres here, and dinner is, to follow at a later date. It's great to meet everybody so that we can have this introduction and then to be able to answer questions going forward. I've introduced myself. I'm Ruby Moore. I'm the executive director of the Georgia Advocacy Office, which is a protection and advocacy system for people with disabilities. That's been my job for the last 17 years, and working with other protection and advocacy organizations and systems across the US and other countries has been my job for 43 years. So I'm just going to talk a little bit about our US protection and advocacy system that's part of the DD network. It's the largest free legal services system for people with disabilities in the US and the US territories. It may be the largest free legal system for people with disabilities more globally, but I'm not sure about that, so I won't make that claim. We have this gorgeous access authority. It's written into our enabling legislation through both the Developmental Disabilities Act and the Protection and Advocacy for Individuals with Mental Illness Act, that we have access to people and files and facilities based on the probable, not probably, probable cause of abuse and neglect. So that also means that we have a higher level, because we have a higher level of responsibility and due diligence around protecting people's confidentiality. We're a cross-disability program, which is great. I'll just give one example. We're within the DD network, but we're also cross-disability. And so at our protection and advocacy system, for example, in Georgia, one of our largest cases is a massive systems reform case that requires the state to build not only a competent developmental disability system, but also a competent community mental health system, and the intentional safeguards for the system to not become the problem it's setting out to address. So we joined the United States Department of Justice in that case. It was based on a death investigation that we did that captured the imagination of our legislature and our media, and then the United States Department of Justice. So that's a good example of the cross-disability nature of our work. When the P&As came online in the 70s, there was an understanding that when addressing protections from harm for people with disabilities, developmental disabilities, psychiatric disabilities, all disabilities, that not every response would be a legal or technical strategy. And so we have a range of remedies, as we like to say. We have the usual things like information and referral, monitoring of facilities, any place where people are receiving services, investigations of complaints of rights violations of people with disabilities. We do death investigations. One of our highest priority is preventing abuse and neglect, including preventing preventable deaths. So you can imagine how busy we've been lately. And then working to resolve complaints through mediation, alternative dispute resolution, and individual and more systems change litigation. So we have a lot of tools available to us, which is really great, because I think our very best, most impactful advocacy work has been when we use literally all of our tools and all of the tools of our partners within the network. So I wanted to give an example of collaboration within the DD network, because that's really our best work. Whatever we can do as an individual protection and advocacy system is only multiplied by tens of times by engaging effectively with our network. And also within, when we think of our range of remedies, it's not just legal work. So we support self-advocacy and we support citizen advocacy, which is engagement of one person at a time in a freely given relationship with someone who has a lot of high social status in the community, being connected with a person who's highly at risk of being misunderstood for who they are, and having their rights and freedoms and, frankly, safeties and protections taken away from them. And so that's one of our programs that we've been doing for over 40 years, which may be the most potent protection and advocacy. People standing by each other who aren't paid to be there through a sense of identification. But within the collaboration, I'll give one example. I have a lot of examples. We have a very significant developmental disabilities network in our state, and everybody's doing their job extremely well, and we like each other a lot, which is also helpful. I got there, and on my first day on the job, the DD director, the Developmental Disabilities Council director, came and said, "So what are you going to do about the death penalty?" So we kind of got a sense of, okay, they're serious, and they're as serious as I am. But one example would be our Children's Freedom Initiative. As the P&A, we were doing our I wouldn't say routine monitoring, because there's nothing routine about finding out that people are being harmed and sometimes killed. And so, but we were monitoring nursing facilities. And as you can imagine, right now, there's a much broader kind of understanding and interest in what's going on in these congregate nursing facilities, and how sometimes those places speed up people's deaths, so, however, unintentionally. So we found out that there were 141 children in these nursing facilities. We don't say nursing homes, because, they're not homes. But anyway, we got together with the network. At that time, we had one University Center for Excellence in Developmental Disabilities, our Georgia, Developmental Disabilities Council, and the P&A. And so we found the kids and said, that's not what children need. That's not what any children need. And that's not what children with disabilities need. And so the DD Council took the lead on really working with the legislature. We all worked on it, but they're better at this than we are. So they took the lead on working with the legislature to push through a legislative bill around making sure that all of the line organizations that had anything to do with children or disabilities or both had to work together to deflect institutionalization and to help us help get the kids out. And then the University Center for Excellence in Developmental Disabilities took the lead on writing the stories about the children in a very capable, poignant, compelling way, which really helped us to bring about thousands of people who wanted to support the work of having children have a permanent home and a loving family and not be put away in these segregated places. As the P&A, we took the lead on meeting all the kids. We went and met all the kids and engaged various allies among the community, including the Developmental Disabilities Network and our mental health allies, because there were kids who were there because of mental health diagnoses and, you know, profound misunderstanding about what children need. And then about 3 years into what we call the Children's Freedom Initiative, bringing all the kids home, not just bringing home the kids who were institutionalized in Georgia, but Georgia kids who were institutionalized everywhere else. And then in the broader network nationally, we talked to our partners in other states, our people who were doing the same thing as us in other states, and said, you need to bring your kids home. So like I had to call the Kentucky Protection Advocacy and say, you have 9 kids in Georgia, like bring them home, stop sending kids here. And we stopped being a receiving state.
Ruby, just a 1 minute time check.
Okay, thanks, Kathy. So just wrapping up, it's still going on because we have changed policy, practice, the law. We brought a class action on behalf of kids who were considered medically fragile. We worked within the mental health system to bring home kids who were being sent there who had mental health diagnoses, and people didn't quite know how to respond to those needs. And in the middle of it, Jennifer came down because the state wanted to bring online another University Center for Excellence. And I'll never forget that conversation. She came down and she talked to the network, because that's how she is, including the stakeholders, and said, do you need this? Why do you need this? What do you want this to do? And we said, we really need a University Center for Excellence that understands evidence-based practices in recovery and positive behavioral approaches, and helping us kind of in our broader community capacity to understand how to support kids who had psychiatric disabilities or who had, you know, dual diagnoses. And so she helped us bring online a second University Center for Excellence. So I'll wrap this up. We have time for questions later, but I've been in the field for 43 years and I've worked in lots of places, and I'm really grateful that we have this very intentional structure for supporting people with disabilities to live full lives and to be protected from harm, including unnecessary deaths and segregation. And it's been a joy to work within this network.
Hey Ruby, can I just jump in quickly to welcome Anne Scortis from Australia has joined us, and also Brian Coffey has joined us quietly as well. So back to you.
Hey guys, thank you for joining us. So now we're going to have 2 people talk to us, a leader in self-advocacy and someone you know, also someone you know very well.
Ruby, sorry
Yes.
to interrupt you. Before we move to Tia and Michael, we're going to have Amy talk about the university centers.
Oh, sorry.
That's okay.
Sorry, Amy.
Speaking and emceeing all at the same time. I couldn't do
I
it.
know. I need job coaches.
No, like I said, I wouldn't be able to manage it. I can barely.
That's Amy. Thank you, Jennifer.
No problem. So I've got 10 minutes to share with you a little bit about what University Centers on Excellence in Developmental Disabilities are. As Jennifer said, there are 68 of these centers across the United States and the US territories. And to give you a little bit of a context of the University Center on Excellence in Developmental Disabilities that I direct, we're housed in a College of Education and Human Development at the University of Minnesota. Not all of these centers are in colleges of education or human development. Many of them are in the medical components of a university setting. We are a freestanding interdisciplinary research institute in our college, and I report directly to the dean. We're 100% self-funded through grants and contracts. So we get core funding from the Administration on Community Living, where Jennifer is. And then one of our expectations is that we have to leverage dollars to really be able to carry out all of the work that we do. So our center's funded, totally self-funded, with a mix of federal and state grants and contracts. I think that's probably pretty typical of many centers, many USAID programs. Some of them do more work, they're balanced differently. They might do more work on their state level and less work federally. We are expected to operate programs that are across the life course, so birth to death. To give you examples, in our center, we have a number of programs that are doing outreach in partnership with communities across the state of Minnesota, in diverse communities, to help them figure out and work to spread information about child development, early detection, those kinds of things. And then we also have a research study on inclusive retirement. So it's just illustrative of how in any one of these centers there might be a very wide breadth of the kinds of projects. So I'm sorry, my dogs are being very loud. Another component of USAID programs are, many do direct services. Some of those are very clinically focused. Some of those are more community focused. Our center is fully community focused and do very little work inside of medical places. There's some broad areas that all USAIDs are supposed to participate in. One of those is research, training, outreach, consultation, and technical assistance, as well as dissemination. So I'm going to give you some examples across all of those areas, and then also give you an example of how we in Minnesota have collaborated well with our DD councils, P&As, and alike. So to give you some examples of research, we do research in a wide variety of areas at our USAID. We have a national center on educational assessment. So we're looking at how educational assessment occurs for children with developmental disabilities in the United States, and what kinds of accommodations are made in standardized assessments for folks. We have a national center on inclusive education, trying to provide technical assistance to states around how they can improve their practices related to including kids with the most significant disabilities in regular ed classrooms. We do a fair amount of work around in-home and residential services on the research front. Some of the data that I shared with you is from a project of national significance that we have, where we've tracked where people with intellectual and developmental disabilities have lived since 1977. It's a longitudinal data set. And other USAIDs have similar programs looking at employment and costs of services. For a long time, we've had a research and training center on community living. It's a big focus of our center. And in that center, we do a lot of work around researching promising practices related to community living and belonging. So it could be looking at the direct support workforce that supports folks to live in the community, or it could be related to what interventions work to promote self-determination for folks. So it's all over the place. And then kind of a last big area that we do research in is outcome measurement. And we have a national center right now looking at home and community-based outcome measurement. So that's kind of an example of our center around research. If I had to say which of those buckets we do the most in, it would be research. We're probably more well-known for our research than some of our other activities. In training, we have a couple of, so I think about training in two buckets. We have some responsibility to train people in the community, And so within the community, we have two programs that I think we're pretty well known for. One is called Direct Course. It's an online training program for people who are in direct support roles, whether that be in support to people with intellectual disabilities, mental health, physical disability, or people who are seeking employment support. It's widely used. It's used in nearly every state, and each day about 680,000 learners access that training system. We also have a program called Check and Connect, which is a major training initiative of ours, which is a high school retention training program for students with disabilities across high school and in post-secondary ed. Then another bucket of training is students. So we have a responsibility to train students. We have a 15 credit hour graduate interdisciplinary certificate program in developmental disability services and supports. And our students in that program come from 15 different academic disciplines across our campus. So it's a widely used, it's the largest certificate program in our college. Another area where we do a lot of work, as you said, is outreach, consultation, and technical assistance. And that really is across a wide variety of stakeholders. I would think all USEDs, and certainly our USED, does a lot of work with our state departments, whether that be education, human services, economic development, employment, those kinds of things. And then with providers. So most of us are doing work to help providers understand best practices. We learn that from our network. If somebody calls me up and it's something I don't know about, I've got this large network of 68 colleagues across the United States that I can call and say, hey, do you know anybody who's doing X, Y, or Z? So that's very helpful. We also have to, one of our requirements is dissemination. At our center, we think of that as knowledge translation. So we do a lot of research, and we want to take what we're learning in that research and turn it into things that will change policy and practice and get it to our stakeholders. Some of the items that we're maybe most well known for, we have a news magazine. It's now online. It's called Impact. That issue comes out 3 to 4 times a year, and it will take a topic like self-determination and summarize the research, but then also a lot of research to practice kinds of articles are in those issues. We have something called Self-Advocacy Online, which targets self-advocates, and there is a section on that website called Research for All. So we spend a lot of time trying to take our research and translate that into simple language, visual ways that people with intellectual disabilities can access. And then we have
Amy, can I give you a 1-minute time check, please?
Yeah, thank you.
Thank you.
We also have a newsletter called Frontline Initiative that targets, these are all online products, by the way, that targets direct support workforce. The one example of collaboration between our DD Council, P&A, and us that I would just end with is we were very late to have an Olmstead plan, one of the last states to have one. And just a contextual piece about the United States, we're a very litigious society. And we had a settlement in Minnesota called the Jensen Settlement. It was a settlement that showed that people were being put in this state institution called MITO, and they were predominantly young African-American men from the poorest neighborhood in Minneapolis. And our P&A took on that case. They did all the litigation. They did all the monitoring. Our DD Council did all the policy aspects, moving the state systems, helping to get us an Olmstead cabinet, and then funding a self-advocacy academy. Our job has been kind of twofold to work with state agencies to create regional centers for excellence in the state of Minnesota that focus on the use of positive practices like positive behavior support, direct support workforce interventions, person-centered organizational systems change. And then we also have engaged in research to follow up on the litigants who were living in that institution and were placed in MEDO. More recently, we've been engaged together around COVID-19.
Excellent. Thank you, Amy.
You're welcome.
So coming up next, and thank you, Jennifer, for supporting me through my bloop. We're going to talk to two people who have a lot of experience both inside and outside of the DD network, as well as a lot of international experience working on disability issues. And so they're going to talk to us about kind of their perspective about the power of this network or how it's moved the ball over the last half a century. Tia Nellis is joining us soon. She's, and I'll introduce her when she gets online, but why don't we start with Dr. Michael Kendrick, whom most of you know. Michael?
I just wanted to unmute. It works better.
Yeah, that's right.
Okay, well, thanks. I actually started my work in this outside of the United States. So in some ways, it's my understanding of the United States began with looking in from the outside. And then when I got to the US eventually, then I got to realize what it's like on the inside. And my last serious role in the US was assistant commissioner for the state DD system in Massachusetts. And then after that, for about 30 years, I did international consulting in several dozen countries. So it gave me yet another perspective. And most recently, I've been re-involved in the US, particularly around the supported decision-making issue at a national advocacy center in the US. So that's my little story. But one of the things I think is worth noticing is that it's very hard to capture, and the speakers had great difficulty doing this, capturing how one thing adds to another. And over 50 years or so, we aren't in the United States where we were. So a lot of these challenges have been very developmental, whether it's housing, employment, safeguards, lots of things. It's over the years you see the progress that's been made. And there has been quite real progress, but it has to be seen longitudinally. If you went for a particular year, you might miss a lot of what came before it and what came after it. It's also a capacity building challenge. And the US, particularly these kinds of resources we're looking at today are very important as catalysts. That they've been behind many of the changes and improvements in the US system. And it's hard to imagine progress in the US without the Developmental Disabilities Councils, the USEDS, and the P&A system, because they've all been very instrumental in pushing things forward. But it doesn't mean that every time they're up at bat, so to speak, that they hit home runs. So it has been an ongoing challenge to use that developmental capacity. And also this is needs driven. And again, we haven't spoken a whole lot about that, but what has created the system has been the unmet needs, the sufferings, the shortcomings, the lacks in the lives of people with developmental disabilities. And the wisdom of this particular set of interveners is that they've been able to engage many of those needs and find ways forward. And in this process have created a vision for what the remedies look like. Without a sense of what you can do about some of these challenges, people just get stalled. And in this case, we've had people that made breakthroughs, even when 49 states aren't making a breakthrough. there's one state that is. And so in the US, it's very important to understand that people are making breakthroughs on needs depending on where they happen to be, in which state, what the opportunities were like there. And so you'll see excellence in one state you won't see in another state. So even though they're the United States, they aren't necessarily unified in their accomplishments or what makes them stand out. I have also been very mindful that the constant need to build vision for what the solution looks like has been a huge part of progress in the US. It's the coming together of a lot of people around a particular vision. And often it isn't that the vision is shared. It's often the vision that comes from a minority of individuals or states, and yet they are the trailblazers for the rest of the country. So in this sense, it's important to see the US not as a monolithic reality, but 50 states all going in their own direction, and often usefully, but not always. So when one can see that, then you can see the leadership challenge of trying to make progress, of marshaling the talent and resources of the US to actually make a difference on some of the variables that need impact on. And so the part of this has been the cultivation of people that define what the leading edge is or ought to be, that get to the leading edge long before anybody else does. And so we see people that have been, in many cases, and we'd see it looking back now, that their vision was 30, 40 years ahead of their time. But they could see back in the 50s or 60s or 70s that there was a way forward, and began the work that now seems commonplace or certainly more accessible for people. But I'm very mindful that without those kinds of leading edge thinkers and pioneers and catalysts, we wouldn't have made any progress like we've made. And I think we owe a lot to these federal programs because of that. They've been seeding a lot of the troublemakers that have gone on to make America do better at many things. And if it weren't for them having the independence to do that often, it's hard to imagine we would have made the progress on some of these issues. And it's not like that's over. We're still in the middle of trying to define what the leading edge is on many, many issues. And I should also add that we often think we're on the leading edge, only to discover we're leading everybody over the cliff. So it isn't that everything's onward and upward. We have lots of periods of regression as well. So I think that gives you a much more of a sense of how dynamic the challenge of leadership is when we're trying to do it with this level of complexity. Now, the tendency may be to look at the idea of leadership as coming solely from people in institutional roles, governments, agencies, programs. But really, if you look much more broadly, and this is where these federal programs have been very helpful, is they have nurtured and fostered the social movements that underline a lot of these changes. And if you like, push for a lot of those changes. And so it's very important to, even though we're not talking about those social movements today, the independent movements that are at work every day in America trying to move things ahead go well beyond our governments. And we think of both, very prominent sort of change groups, but there's also many, many at the state level you'll never hear about who are doing very, very good things by way of leadership, but on a relatively small scale. And so these social movements, really, we don't have time to get into them today, but behind all of these innovations and progress have been people pushing for them and providing leadership. But outside of established authority in many cases. And so in this sense, think of the DD councils or the P&As or the USEDs, they're sort of got one foot in the system and the other foot out there stirring the pot with people that aren't in the system and getting paid for it, which is a remarkable way to make a living, to stir it up and to make progress and send the bill to the Fed.
Michael, you have a 1 minute time check, okay?
Okay, one last thought is Americans have done a very good job of documenting much of what they've done, for better or for worse, which creates a legacy as well of a whole mountain of evidence, studies, reports, and whatnot, that if you're looking for resources, I think the US has an ample and very impressive supply of those, not just because it's a big country, but also because the quality of some of that work is excellent. And it's helpful, I know it's very helpful to people outside the US as well as inside. So I just wanted to finish with complimenting the people that have produced those resources. There have been many of them. Thank you.
Thank you, Michael. So Tia Nellis has joined us, and she's really an international self-advocacy leader. She was the first co-chair of Self-Advocates Becoming Empowered, which is a national self-advocacy organization in the US. She's currently the Advocacy and Policy Director for TASH, which is an international advocacy organization advancing the civil and human rights of people with disabilities. Tia, thank you so much for joining us. I'm sorry that it was a little difficult getting on, but we're really glad to have you. And we're at that part of the program, as you know, where people who have worked both you and Michael Kendrick, who've worked both inside of all of the DD network partner systems and outside and have a lot of international experience, are kind of weighing in on what do you think the collective impact of the DD network has been, or anything that you want to say about it, frankly, because nobody tells you what to say.
Okay, so thank you for having me join this very important call. I think I want to start with telling you my position. I work now for TASH, which is an international advocacy organization, national organization, and I'm the policy and advocacy director. I used to work at the University of Illinois at Chicago as a self-advocacy specialist, and I have worked with all of 3 of the DD networks. I worked doing some work with the P&As around voting, which is a very important project to help teach self-advocates about voting, and to work with P&As together to advocate for legislation around voting to help support people with disabilities to be able to have access to voting, to be able to speak up for their rights around voting, to be able to have training around voting, because not a lot of people have that opportunity to do some training around voting. While doing that, working with the protection and advocacy, it builds stronger bonds together with people with disabilities and the protection and advocacy organization. It started giving us ways to work together as a team and making sure that we work on partnerships. And then also it was really great to give us that opportunity to work on other projects together. Because once we started working with each other on one project and you start to get to know each other better, it gives everybody an opportunity to be able to do that and share each other's resources, and then maybe work on future projects together, so that people could educate other people out in the community, and they could see that people with disabilities and without disabilities can work together as a team. So that's one part of the things that I've been doing with protection and advocacy. And then there is a lot of my friends who are self-advocates who've been working in protection and advocacy agent organizations and played many different roles, from being on their board of directors to doing all kinds of things, helping, supporting their different kinds of committees that are out there. So I think that that's a really important role for people with disabilities to show other people and role model for other people how to work together as a team. I think that that's a really good start for all of us to get other organizations to, like the protection advocacy organizations, to start hiring people with disabilities and work together and learn how to get pieces of legislation that's important passed, and also learning from them what important pieces of legislation that they're working on to help protect people with disabilities rights. So I think that's a couple examples that I have worked on and my friends have worked on during working with the protection and advocacy organization. I also worked for 26 years at the University of Illinois, Chicago as a self-advocacy specialist. The USEDs play a really important role. They do some research, which they were involved in. I helped do some research while I was there working on my job, and other people with disabilities are on their committees and councils that they might have, their consumer advisory boards, giving important information to the USED about what's important to people with disabilities and how people with disabilities can be on research projects. It's really important that the voice of people are heard. And then the really awesome thing that I did when I was working at the USED is I worked for LEND. And LEND is the Leadership, Educational, Neurological, and Other Developmental Disabilities. It's an opportunity to be a LEND trainee, is an opportunity to teach other people who are in their careers about how to work with people with disabilities, and to learn the different things that people with disabilities are doing out there, and to share information with the educators, with the parents, with like OT, PT, speech pathologists, other people like that. All of us learning together and working with each other. That gives an opportunity for us to learn from each other and start to work. A lot of times when you're a leader, you can learn many different leadership roles, but you don't always get the opportunity to learn about the health side of disability, about the medical side. And LEND gives you that opportunity to also learn about the medical side, but also to teach those medical professionals how to interact with people with disabilities, how to talk to them and support them when they're doing those things. And so I was a LEND trainee, and then I was really kind of sad when I was going to have to leave LEND, because I did graduate and pass the 300 hours. It seems like a lot of hours, but you get a lot of supports. So I passed and I was a LEND trainee. Then after I was a LEND trainee, I was sad and I thought I was gonna have to leave LEND. But then I got this really great opportunity to be the self-advocacy coordinator for LEND. And I'm still doing that today, even though I live in Maryland. It's just still opportunity to work with the new LEND trainees and the parents that are in LEND, and all the other students who are learning how to interact and work with people with disabilities. So that's really an exciting job. And I think that it was really a great opportunity to tell other people out there that people with disabilities can be a part of that program, because at first they weren't so sure that people with disabilities were going to be able to do that. And so I advocated really hard to make sure that people with disabilities get the supports they needed and to be a part of LEND. Now I'm not only the LEND self-advocacy coordinator, just me anymore. Since I've been in that program, and other USEDs have gotten together and came on board, there are more self-advocacy coordinators in LEND, and there are more LEND trainees that are self-advocacy trainees, and they're a part of LEND. So I think by doing that, the university, is given opportunities. All the USEDs are given then opportunities for people with disabilities to educate more professionals about how to work with each other. And also it gave those parents the opportunity to see other people with disabilities like their child, when they're seeing that their child might not be able to do this or they might not be able to do that. They have other role models to see what people with disabilities are really doing out there in that world. So I think it's been a great opportunity, very exciting to do that and to be a part of that so that people could interact with that. And again, there are USEDs that are now hiring people with disabilities for jobs. And that's really exciting to me because we need to have not also think about just jobs in the world, but about careers. And what a great career that can make if you work for somebody like that.
Hi,
And
Tina.
the last,
It's Kathy.
Yeah?
I just need to give you that 1 minute time check.
okay.
Thank
And
you.
the last thing I want to talk about is the DD councils. The DD councils are really great, and it's a great opportunity for people with disabilities to work on projects that they give out. They send out different things around self-advocacy, around different projects that can help people with disabilities advocate and do projects around things that are important to people with disabilities. The DD Council also, some of them have partners in policy making. And if you've ever been a part of partners in policy making, it's an opportunity where family members and the person with the disability work together around different projects that they can do to help build their leadership skills and to find their voices. And they do a project at the end, and they also learn about systems change and many different things like that. And the DD Council is also hiring more and more people with disabilities. So I think altogether in the DD network, it's taken a while for us to advocate and to learn how to work with each other. But I think all of us working together as a team and starting to learn about each other is really making a difference for people with disabilities in the world. So I thank you, and thanks a lot for having me.
Tia, thank you so much. And let me just also say, we haven't been talking about the elephant in the room about the COVID virus, but I just want to particularly thank you for, at a time when all of this is happening and people are particularly isolated, and a lot of people with disabilities who already feel, isolated or disconnected or lonely, you've created forums, national and international platforms for people with disabilities to connect with each other, often hundreds of people at a time, to know that they're not entirely alone during a really difficult and confusing and scary time. So thank you for your leadership on that.
Thanks.
Hey, Ruby, do you think I could just jump in for the moment? Ruby and Jennifer, just to say we've got 15 minutes left, so we're probably running about 20 over time. So we've probably just got like maybe another 5 minutes opportunity for a bit of a forward sort of view around some of the challenges, and maybe the invitation for sort of, collaboration and connection. I would like to keep about 10 minutes for some questions, but also to let you know, we'll keep the room open for another 15 minutes after that. And so if people need to leave on 2 hours, then please do that. If you can stay on, we'd love you to. And if we've not been able to get to your question through chat, we'll print the chat and we'll actually get back to people individually. Okay, so Jennifer, does that sound reasonable now? Like a bit of a 5-minute sort of picture of some of the challenges coming up, and then maybe not, you know, an invitation for collaboration, and then we'll go to the chat and to some questions. Thanks.
Yeah, that is where we are at this point in our presentation. So if Seth, you could pull back up the PowerPoint, or maybe you have. I'm having some connectivity problems here on my end. And so I may not be seeing everything in real time. We did want to close out by just looking forward in terms of some of the challenges that we know are before us in the US, but also I mentioned that we in the federal government or in ACL, we have what we call projects of national significance, which allows us to invest in projects that address national priority issues, and some of them you've heard about today. And that's how we framed the discussion around future challenges that we are facing. Certainly, especially under COVID-19, we have concerns about the infrastructure of community-based services and the direct support workforce, and the supply, basically, of the direct support workforce. And we do have some work that we're investing in related to that. Also, just healthy living with a disability and healthy aging is something that we're definitely looking at and trying to better understand as people live longer. You've heard a lot about prevention of abuse and neglect and monitoring to do that, but as more people move into the community, we're trying to better understand how do we strengthen how we monitor people living in the community to ensure that they are free of abuse and neglect. Employment and youth transition continue to be ongoing issues that we're concerned about. And again, we're funding projects looking at how to support systems and also work on youth transition models. Co-occurring conditions is another one that we've been addressing. We have some work invested to train individuals and increase capacity, because we find that these are oftentimes the most difficult individuals to keep in the community, and then they oftentimes return to institutional settings. And then lastly, we've done work in alternatives to guardianship and supported decision-making, so that people are more empowered and supported to make their own decisions, or to be supported in making their own decisions. So that's just a real highlight of some of the discretionary investments that we have right now, but also where we're facing or where we're focusing a lot of our attention at the national level in these areas. And so I just want to open it up to my colleagues to see if they have anything that they would want to add to these particular topics or issues that we're facing.
I think Isabel wanted to say something about supported decision-making, and Seth wanted to weigh in on employment.
Sure, thank you. I'm Isabel Hodge. I'm the Executive Director for the U.S. International Council on Disabilities. We hold UN consultative status and led the campaign for ratification in the U.S. I also serve as Vice President of Disabled Peoples International, North America and the Caribbean. And I really want to thank Michael for mentioning supported decision-making earlier in the session. You know, as a result of the CRPD in Article 12 and national recognition, supported decision-making has taken hold in the US. Right now we have less than 20 US states and Washington, DC that have introduced legislation and resolutions that refer specifically to supported decision-making, and each state is implementing them differently, which presents challenges. So for example, in some states they've had like supported decision-making as a least restrictive alternative to guardianship should be ruled out before a court would order guardianship. And other states are conducting studies on it, supported decision-making, and some have made some very specific kind of supported decision-making for medical decisions, such as organ transplants. However, there really is a movement towards formally recognizing in statute supported decision making and the role of its role in the lives of people with disabilities. We're also seeing our courts recognizing supported decision making and more endorsements by national organizations such as the American Bar Association and the National Guardianship Association and the federal government agencies such as Health and Human Services and the National Council on Disabilities. And speaking of the National Council on Disabilities—
Isabel, could I give a 1 minute time check for this section, please?
Yep, thank you. There really is a lack of data on existing guardianships and newly filed ones. And so we feel that collection of data around guardianship and supported decision-making is important, and as well as funding for public services is equally important. And then there have been, situations where we recognize the fact that, individuals subject to guardianship might not have the means or know how to file a petition to have their rights restored. So there's right now 20 state statutes and a revised Uniform Guardianship, Conservatorship, and Other Protective Arrangements Act, which permits informal requests such as handwritten notes and verbal requests by an individual to have their rights restored. So this is a good shift that we're seeing in the United States. And if you'd like some more resources on supported decision making, then the website for the National Center is supporteddecisionmaking.org. Thank you.
Oh, and hey everyone, this is Seth Colson. I'll just jump in really quick. I'm our State of Washington's Director of Training and Technical Assistance, which is, let's say, a part like a indent from the USEDS. We're kind of a community-based organization that does training on supported employment. And coming in at the end of all of this, one of the things listening, I was giggling when Michael was talking about the uniqueness of all of the states. In the state that I live in, it's kind of a rabid state culture about employment and the importance of employment for people with disabilities. And so growing up in that, I started out with blonde hair, worked on employment, turned my hair gray, and now it's growing COVID style, really long. And what I want to say about all of this is that the message today is the same in employment as it is in our whole infrastructure in the United States, which is we're kind of like a braided entity. All of these things have to be these strong strands of services and supports. And the way that it all ends up working is if they all get woven together and they work together really, really well. And in employment for us, it is the same thing. You have to have all of the parts and pieces in play. You have to have training. You have to have employer engagement. You have to have people with disabilities leading in front with what they want and need for their careers. And you have to have strong governmental partnerships like are represented here today. The examples are extraordinary. All funding the thing that you want to see happen, which is one person getting one job that works for them to meet a business need. And that's something I could talk about for days, but I think it's kind of a fun thing to wrap up with, because in the world we live in right now, one person understanding what their needs are in relation to how they can contribute in their community is the way we're all looking at moving forward to be healthy and safe and contributing again in our communities. And it's never more relevant and real to me than looking at individual squares of people from around the world and seeing that we all have our uniqueness and we're all kind of in our little boxes right now. And so we've got to think about how we're going to reemerge collectively, but uniquely individually to make sure everything moves forward. So I know we're running on time, so I'll just leave it at that, and I'm honored to be part of the group.
Hey, Ruby, maybe if I could just jump in quickly to say we're about 3 minutes from the official end time, and I'm aware that some people might just start dropping off the call to go to other commitments. So we will continue, but I just wanted to really just make the point that we've had an amazing series of presentations. We've all met each other now virtually So we have relationships, and if people do drop off the calls, just to know that now we will have, we'll have details, contact details, we'll have the PowerPoints, we'll be populating resources on the website. So we really encourage people to take up that personal connection. And maybe just before I do go to some questions and that, Ruby and Jennifer, if you just want to make any sort of concluding comments, and then I wanted to go to Bob Glover for the first sort of commentary from the chat. So Ruby and Jennifer, anything you want to say before we open up?
Yeah, if I could, just on the point about making connections, in the PowerPoint, there is a slide with links to resources where you can I see the DD councils, the state P&As, and the USAIDs in each state and territory. You probably have the sense that there's a wealth of information and resources within these networks. And so the idea of connecting, I think we're at the tip of the iceberg on that. And there's many different kinds of connections that we can certainly facilitate, but at least getting to know them, I encourage you to take a look at those links on the websites and access those to learn more. In terms of closing remarks, we certainly appreciate this opportunity to be able to talk about this, like I said, a unique network of programs that have really worked towards driving change in the U.S. And we really do hope that we've given you in this hors d'oeuvres setting here the sense of what it is that they do and what they accomplish in the U.S. for people with intellectual and developmental disabilities. So with that, I know our time is short. I'm going to turn it to Ruby.
Yeah, I just want to say thank you everyone for coming, and I think the hallmark of really great advocacy and standing with and by each other and true sustainable social reform is personalism. And I think IIDL, IIMHL, and these kinds of forums allow us to connect with each other, so you can put a name to a face. If you're trying to navigate a complex system, you won't get it from a 2-hour presentation, but you will have figured out that among and between us, there's somebody that you said, I could call her. And as Jennifer said, we're perfectly happy to help you navigate our system. As Michael said, we don't imagine ourselves to have solved all the problems, but everybody's on this call because we've made very significant commitment, even some of us consider our calling, to figure some of these things out together. And so I just really appreciate that we have an international group of people, and whatever the differences are in our cultures, there's some universal, realities about what people need and the kinds of things that people with disabilities often face. And so I just really appreciate that we're all together and that we had the opportunity to give a brief introduction to a very intentional network that's been in play for 50 years. And as Michael said, quite extraordinarily has been funded by the federal government. It's unusual for the feds to say, we want you to go stir up some trouble, and we'll pay for it. So thank you for joining us, and I'm looking forward to continuing the conversation beyond the borders of the hors d'oeuvres we had, tonight.
Excellent. So just now, for those that can stay on, we can go for another 15. So there's an opportunity here. So I did want to go, Bob, as chair of the IIMHL board, for your sort of first comments and reflections. And then I think I've got Aisling lined up for the next question. And anybody else, if you want to let us know on the chat, we can pick up questions after that. So Bob, to you first.
Thank you, Eddie. We're all under pressures and stresses right now, and I want to talk just briefly about what I see as opportunities for improvement, of all our systems. And I want to share things that really struck me were the values of people speaking for themselves. It's really there in the IDD, IIDL kind of community. It's in the mental health side of the equation. That lived experience is terribly important. Meaningful inclusion is part of that. I want to share that our board is feeling the same way in terms of representing, and you all representing your positions and hearing from you and participating in that kind of initiative. So I just want to say I'm delighted, and I learned a lot today, and we look forward to our associations working together and learning from each other. And the diversity is terribly important. And I just want to thank you, Eddie, and everybody that presented today for a very impressive kind of issue. Thank you.
Thanks very much, Bob. Aisling, I think we're to you.
Wow, what an amazing 2 hours smorgasbord of ideas and information. So thank you so much to everyone who presented and helped to make this happen. It's been a really wonderful start to the day down here in Australia. So I guess kind of coming back to the theme of the whole session, which is really about this vision for community living and this vision for full citizenship. I was really fascinated, and it kind of built throughout the whole series of presentations, and I owe a particular thank you to Michael and Tia, because I think they really articulated it so well. Michael was talking about how do you build a shared vision, and Tia was talking about working together as a team. And so I wanted to kind of throw to any of the presenters who this generates some thoughts for, because it really resonated with me. What are some of the strategies that you found are successful to share and communicate and build this shared vision of what community living and full citizenship can look like, in particular for those groups or those people who are not thinking deeply about this, who this isn't what they live and breathe? So I'm kind of thinking mainstream services or mainstream civil society. How do you bring them into that shared vision?
So this is Jennifer. I would ask for either Ruby or Beth or Amy, I don't know if Amy's still on, or Twara, to really talk about how they, in their states and territories, utilize their role as representatives of the programs to do that. I'm sure they have a lot of great examples of how they accomplish that.
Yeah, I don't mind starting for a minute, just to say that, first of all, we don't do anything, literally we do nothing without people who are affected by the ideas that we think might be helpful in lifting the veil on, the things that are hurting people or even speeding up people's deaths. And so we're standing side by side with the people who are most directly affected by the topic at hand. The other, I guess, we've kind of separated out our thinking around the difference between systems change, which is, there's always a pull towards systems change, and without debating about whether that's legitimate, too ephemeral, or even invalid, we also pay attention to what true social reform is. And that means having to pay attention to asset-based community development. It means having to really involve relationships, associations, partners, the likely allies, the unlikely allies, and really to say, if we begin with universal human needs, and then we say, what are those unmet needs, not just for people with disabilities? Instead of going, we need to carve out for people with disabilities, which is kind of shooting yourself in the feet if you're trying to deconstruct us and them, which is the big game, then we have to kind of say, what does this community care about? And then what are the intersections? Like Seth was saying, everybody's worried about employment. So instead of saying it about disability employment per se, you're saying everybody's worried about employment. What are the avenues to get back into employment? What are the avenues for recovery, and so forth? And we tend to use those tools so that we have more sustainability.
I'll speak just about councils, we actually do this in practice in all of our daily business. I did not describe some of the details of how our council is constructed, but we have 27 members here in Texas. I mentioned that 60% are individuals with developmental disabilities or family members, and the rest of the representatives are the folks that you see here from our DD network, but also representatives from every program in our state that provides direct services to individuals with disabilities. So our workforce commissions, our health and human services, our education program, all of those folks are sitting there. And it's really sort of a beautiful arrangement because you get the individuals who are living the experience to say, this is not working for me. And then sometimes the representatives from the agency say, well, it's supposed to work, so let me go back and try to fix it. Or they say, I never thought of it that way. Let's really try to do some systems change. But to your point about how do you kind of create that common vision, as you can imagine, you get 27 people in a room. They're not going to agree on all things disability related. We can very quickly get into the weeds. That because we are governor appointed, because they are a state board, we are able to say, let's put your individual opinions aside and let's really talk about what is best for our state. And so it kind of forces the group to do exactly what Ruby was just describing, kind of figuring out what your assets are and your common themes are, and really trying to focus on the way forward from more of a big picture vision.
This is Tora, and I'll share with you that I find very exciting. We've not had any institutions in the District of Columbia since 1992. However, we have had a developmental disabilities system of services support that really had been driven by litigation. I know that Amy made reference to how litigious our society is. And it was a very long case in terms of closing institution and moving everyone into community settings. I would say that currently now, I'm excited about the fact that we have a chance to create a new vision. And we are working together to look at what could community living look like, and not thinking about current policies, not thinking about resources, but what do you envision? And it gives people a huge layer of freedom to not think, well, this agency only does this agency only does the other. And we'll be working with our District of Columbia City Council, which is our elected entity. And I think that bringing people together, including having people to think really about, you live in early intervention world or young children, you're over an adult system, but what would a continuous system be able to look like? So we're going to be doing that this year. It will probably be virtual rather than face-to-face, given what's going on right now. And I'd be very happy to share with you what those results are. Our current system only serves our developmental disabilities agency only serves adults starting at age 18, and lots of other people, children, etc., fall in many different categories, but there's not a cohesive system of services and supports and community living because of the litigation. And we've been, I'm just gonna say, held captive to the litigation, even though it's all over, and we need a new path forward.
This is Amy, and I'd like to just respond to that kind of from a research perspective. If I look at our research over the last 15 years, we've increasingly stopped doing research within the provider service system and are focusing much more of our research on community. And I'll give you a couple of examples. We've done research to try to figure out, well, how do you best develop social relationships, genuine social relationships between people with intellectual disabilities and members in their community. And when we compared going through the group home and working with staff to help build those relationships versus going to the local Lions Club or the local YMCA or wherever, the outcomes are so much better when the intervention is targeted to the community. Very similar outcome in a study we had called Putting Faith to Work, where we knew that faith communities in our community, many of them have employment programs within their, they call them employment ministries a lot of times, across various faiths. And their job is to help members of their faith community who have become displaced or who are looking for jobs network with other members within their faith community to find jobs. And when we ask them, well, are your members who have disabilities, are you working with them? And they weren't. And so the intervention again was with those faith leaders to teach them how they might best support members of their faith communities to find jobs. And the outcomes in that small demonstration project were, the numbers were actually just completely opposite of going through an employment provider. So about 85% of the people who got their jobs through their faith community, through their faith ministries, got jobs, were placed in full-time jobs, part-time jobs, and were there 2 years later. And that's just completely opposite of the disability service system. So we're increasingly trying to write our research proposals where the intervention happens in the community. And as we're thinking about, you know, how do we envision our future of services in our state, we're really trying to figure out, does all the money always, Medicaid locks us into the service has to be delivered to the individual because it's a health program. But what if we could take some of that money and work with the community to provide supports and inclusion? So.
Great, Amy, I'm going to need to jump in. I think we could just keep on going layer after layer. And so what I'm going to do is I'm just going to wind up the recording and then we can just stay online and maybe do a bit of a debrief, if that's okay. So just to wind up the recording, I just wanted to say an enormous thank you for the richness and the depth and the generosity of all the presenters. It was just extraordinary how much wonderful information there was and how strong I think the personal connections were. So as people were leaving the chat, they were all sending beautiful messages about how much value and how much connection there was from this morning. So, or from this evening. There will be resources on the website. There'll be opportunities to follow up. So I just wanted to close by saying thank you all very, very much. And I'll just press the stop recording. Yep.